We are here to talk about arthritis. It's a general term indicating inflammation of the joint. As the term indicates, itis means inflammation. The joint inflammation is called arthritis. There are more than 100 causes of the inflammation of joints. The main ones which we see in our day-to-day life with the most common occurrence are the inflammatory arthritis, like rheumatoid arthritis. What happens? There is an antigen-antibody complex formation that goes and causes the inflammation of synovium, the so-called membrane of the joints. This leads to recurrent inflammation and ultimately destruction of the joint. Another form of inflammatory arthritis is ankylosing spondylitis, or it could be a part of other arthritis complexes. One more commonly used type of inflammatory arthritis could be chemical arthritis or crystal-induced arthritis, where the crystals of uric acid they get deposited inside the joint membrane and causes recurrent inflammation of the joint membrane, again leading to destruction of the joint. The most commonly seen arthritis is osteoarthritis. This is not the right term as you don't see exact inflammation of the joint. Hence, it has been called as osteoarthrosis, where because of generalized wear and tear of the joint, there is recurrent mild inflammation of the joint leading to destruction ultimately. Osteoarthrosis can be primary or secondary. The primary osteoarthrosis occurs in the older age group because of general wear and tear of the joints. As it happens in the joint, between the two bone ends, there is a rubbered sole-like structure called cartilage. This cartilage, because of excessive loading, it wears out. It is worn out completely. Now when it is worn out, the bone ends they come and rub against each other. Like if you have to see the example, you can see this is the example of the knee joint. The patellar kneecap has been taken off. Here you have a bent knee where this dark blue structure indicates the cartilage. You have cartilage at the end of the thigh bone and at the upper end of the leg bone. This acts as the shock absorber. As long as we are walking, running, jumping, doing all those activities, the stress comes onto this cartilage. With the age, this cartilage wears out, erodes. Now, when there has been complete loss of cartilage, whenever a person stands, the bone ends they come and rub against each other, and this causes pain and inflammation. Subsequently leads to deformity when the knee shape gets altered. Most likely there is inward bowing of the knee joint called varus deformity. There is secondary osteoarthrosis when your knee joint has already been compromised either by trauma that causes injury to the cartilage, or with the trauma the shape of the joint surface has been altered. Or it can be seen after multiple episodes of inflammatory arthritis like rheumatoid arthritis or even synovitis caused by crystals like gout. All these causes also lead to ultimate onset of osteoarthrosis.